Hello and welcome to the Coralosophy podcast. I'm Chris Muntz and this is episode 75, The Delta Variables with Dr. Tracy Høeg. Tracy is back with me for the second time, so we're going to be catching up on, of course, another COVID school year and some of the things that you need to know. We will be discussing the things that are relevant to us as teachers, but also as citizens, seeing the very scary news coverage and the very scary headlines. Some of that we all know when we watch the news and click on articles is hype, and some of it is real. And so Tracy is with me to help us cut through the hype like she did last time and talk about some data and some numbers and offer some analysis on what's been going on. We will be discussing things like, is Delta more deadly or more dangerous, or is it just more catchy? Some of those things have been confusing for people. We're going to be talking about specifically how Delta is being discussed with children versus what the data says. We're going to be talking about that and many other kind of COVID communications, snafus, and frustrations. Hopefully, this episode will put your mind at ease. And as I've been saying every time we talk about COVID on this show, not putting your mind at ease because COVID's no big deal. It's putting your mind at ease because a lot of our fear and anxiety when we're talking about something like COVID just comes from not knowing what's going on, being confused, wondering what will be coming around the corner. And I've always felt through doing these episodes in this show is I've always felt that it's comforting simply to know more. No matter what I currently know, I would just like to know more. And that's Tracy's purpose here on the show. Before we get to Tracy, making sure that you know that the Coralosophy podcast is completely listener supported. And what I mean by that is we don't have some big corporate overlord here that is paying my bills. We don't have a sponsor that is paying my bills. In fact, we have 5 sponsors who I'm able to support by talking about their products. And then when you, as the listener, choose to go to their websites and use that promo code Coralosophy at checkout, you then are supporting this show. So when you go to sightreadingfactory.com and renew your memberships for this coming school year, which for you and your students is critical. You got to do it. It's a must-have in your classroom. You can enter Coralosophy at checkout, get 10% off the whole order, and that helps me. You can also get your singer's masks, your resonant singer's masks, which you're going to need this year as well, as Tracy and I will discuss. In fact, you're going to hear us discuss some of the reality, the cutting through the hype of masks. We've been talking a lot lately about, this idea that we have to toe the line and say the exact right thing all the time, like masks work. And then you got other people that say masks don't work. Okay, well, here's the reality, guys. Masks don't work and masks work. Those are both true statements. It depends on what your context is. In other words, how you're using the mask, what kind of mask you're using, the time you spend in the mask around a potentially infected person. All of these things are context that if you simply say masks work, you are probably missing some really important context. Because in the same on the other side, everybody, if you say masks don't work, same problem. You're picking out the context that they don't help very much, and you're focusing on that. The reality is there's both. There are contexts when the mask is very helpful, very useful, and there's context where it doesn't. Well, for singers, we crowd a bunch of ourselves in a small space and we breathe a lot, right? So that singer's mask, the quality and the construction really matters. So the resonant singer's mask over at mymusicfolders.com is the one I proudly sponsor on this show and discuss and plug to you. And you can get a discount. They've lowered the cost from last year. They've made so many of them now. The cost has come down. Plus, you can continue to knock 5% off when you enter Coralosophy at checkout. All right, everybody. The other most important way, probably the most intimate way you can support the show is on Patreon. Patreon.com/Coralosophy is a listeners community that has boomed in the last month. This has been my biggest growth month over at the Patreon. We're up to almost 85 members over on the Patreon, and they're getting value and they're getting behind the scenes episodes, private episodes. Some of my presentations from this summer are being loaded there. I'm creating a shared Google Drive folder for all the materials that I've dumped on the Patreon feed over the last couple of years. So I'm going to try to consolidate that. It's a great resource for you and mostly just a way for you to help me underwrite the cost of this show, which continues to mount every year, every month. So thank you so much for your support over on Patreon. The Patreon producers are Vasquez Academy of Music, Ulrike Igrain Munoz Alarcon, Chandler Smith, David Kowalczyk, Kyle Peterson, Michael Herron, Ryan Main, and Stephen Kathy Kakachik. Thank you so much for that boost of support over there at Patreon. Okay, everybody, I am here again with Dr. Tracy Høeg, who is here to kind of unpack some of the recent news and the topics that we all care about when we're going back to school with COVID and Delta and all the scary news articles and all the things that we've been inundated with in the last couple of weeks. So Tracy, thanks for coming back on the show.
Thank you so much for having me. I'm a big fan of the show, so it's an honor to be back.
Well, great. That's awesome. One of the things that I appreciate about kind of being able to be in communication with you since November, as we were just discussing, and you were on the show before, is that there are lots of things to care about related to COVID. It's almost as if we were to just pick our pet project. COVID has affected so much of the world and every aspect of the world. You could maybe decide that you're going to really care about how COVID has affected supply chain problems or economic problems, or of course the elderly, or long COVID, or there's so many. Its tendrils have touched so many things. But of course, for myself, I'm a teacher, and you've seemed to have zeroed in on COVID and kids and school issues as the thing that you care about, which is great because that's kind of what we need to think about and talk about as teachers. So for those people who might not have listened to the episode that I did with you back in the fall, just give us the quick overview of how it was that you first got into COVID and kids as your and schools as kind of your pet project for this.
Yeah. So first of all, I'm a physician and I have a PhD in epidemiology, and I was very interested from the beginning, obviously, in COVID and keeping myself and my patients safe, and learning about how the disease was spreading. And I have kids. I have 4 kids, and I was also very concerned about them, especially in the beginning. I didn't want them to be going to school. I thought it was dangerous. I was concerned about the teachers and concerned about, schools being viral hotspots and super, spreading locations of the disease. And then, so, a few weeks went by, and I started realizing this wasn't just a temporary thing, that schools were closing. And basically, I started watching very carefully what was happening in Europe, specifically Denmark, because that's where we had moved from. And I noticed that they were opening the schools. So that was after they had a 6-week lockdown. And lo and behold, their case numbers went down after they opened the schools, and they were able to keep them open. And then the same pattern happened in Norway, and then it happened in Holland. And I was really excited. I was excited for my kids because I thought, okay, this is great. Like, it seems like COVID is, generally affecting kids in a mild way. It seems like they've been able to open up schools without there being severe, spreading events or teachers dying from being exposed to the kids. And I thought, this is all really good news. So then the schools never, obviously, many schools never opened in the United States that spring of 2020. And then it seemed like there was momentum to start opening them. And I just got really fascinated in sort of following the epidemiology of how COVID was spreading in kids and how it was affecting them, basically out of self-interest because of my own kids, and realizing that this virus was different than the other than viruses typically are, and that it was sparing kids, and it didn't, relatively, and didn't seem to be spread by them very much in schools. So it was different. So it was a point of fascination. So I basically started reporting on that, in my circles, and writing about it on social media, and meeting people who are interested in studying it. And then the United States basically over the summer kind of diverged from Europe, as many people know. And around the time that Donald Trump said we're not going to open schools. He said we should open all schools. Right? Lots of opposites in this world. So he said we should all open schools, and then suddenly it became seen as a very dangerous thing and a wrong thing by many people to open schools. And so I started seeing a disconnect in what was happening epidemiologically, scientifically, and what was happening in our country. And I was worried about the implications for kids in the United States. And so I started getting involved in some research projects, one of which we discussed on the last show, which was published by the CDC, which was the Wood County, Wisconsin study looking at the amount of viral spread happening in schools in Wood County, Wisconsin, in K through 12 schools. And since that time, I've been continuing to do research related to that and have a bunch of peer-reviewed articles under peer review right now.
That's awesome. So for all the people listening who listen to my show who enjoy making fun of other people on the internet for quote, air quotes, doing their research, you actually do research in this area. So this you're not just Googling things.
Yeah.
You're doing research.
I do research about it pretty much in any way that I can, and I use the best resources I can get, and I try to work with as many smart people as I can and get teams together who, have also dedicated a lot of time and energy to studying this topic. And, I'll just point out, I'm a physician in private practice, and I do this all on the side of my job. So I'm not being paid for any of this research. I don't have any, I don't have anyone basically paying me to tell me what to say. So I'm really just interested in getting accurate information, out there and discovering the truth myself.
Right. So, in fact, I think I remember when you were talking about the Wisconsin study on the last show that it's episode 49 for those of us who haven't heard it. I don't believe it was yet published by the CDC when we talked last. I think that happens in between. And so it seems like you've become quite fancy. So that was like a big, that was a big citation for you. That's awesome. And then ever since then, I noticed that you've been kind of commenting more and more on this topic. In fact, you even wrote an article in the Atlantic or was it co-writing or something? Tell us about that.
Yeah, so I ended up writing a few op-eds actually after the Wood County, Wisconsin study. So I wrote one, three basically related to school reopening issues for USA Today, The Hill, and the New York Times. And then basically all kind of focusing around safe ways for, reopening schools, prioritizing reopening schools, and kind of also focusing on the CDC guidelines from last year that I and my co-authors felt were overly restrictive in the sense that they weren't permitting, school districts to open. And we didn't feel like judging the science that was reasonable, that there were too many downsides of keeping schools closed and the upsides were not, clear. So those three op-eds are out there. And Monica Gandhi was my co-author on all of those. And then there were a few other co-authors. And then the piece in the Atlantic, that was with Monica Gandhi and Vinay Prasad. And we talked about vaccinating the world and how to best use the limited supply of vaccinations we have. And we're arguing basically that we should be prioritizing vaccinating higher risk older adults and high risk adults across the world before we start vaccinating children in high income nations, because of equity, and also, because adults are by orders of magnitude affected more severely by COVID than children are, more likely to die, more likely to be hospitalized. And so, in our view, that was a more equitable and, ethical thing to do.
Right. So let's drill into that a little bit, because we hear this a lot. We hear in some of the toxic online discourse related to COVID, which is one of the worst things you can talk about, but it only seems to be toxic when cases are going up. I don't know if you've noticed that. We tend to talk about other things when cases are going down. When cases are going up, it gets very toxic. I've noticed that it's very much like gas prices. When gas prices are going up, it's all over the news. When gas prices are going down, we don't really hear about that. And so since they're going up right now, we have that same toxicity happening at the moment. And we hear a lot about what you just said, which is that kids are affected, way less. And then what we will typically hear is, well, it's about more than just dying. Kids have a very low infection fatality rate, sure, but there's all these other things. But my understanding, and of course I'm a layperson, that's why you're here, is when I read studies and when I try to look at data presentations, I see that the risk to kids for all the things that we care about, so hospitalization, long COVID, death, severe disease, are all way lower for kids than, and it's not even close. Is that accurate?
Yes, no, that's completely accurate. I mean, in terms of long COVID, it might be comparable, but even for long COVID symptoms, the most recent studies are showing that the largest study we have showed symptoms at 2 months after infection. About 1.8% of kids who have had symptomatic COVID will still have one symptom or more, compared to 0.9% of controls who are negative. So that's been reassuring. And the hospitalization rates per case have actually been pretty consistent all along, even with the new Delta variant. From what we're understanding, we're just seeing right now that there's a large rise in cases, especially in the southeastern United States. And so we're seeing more hospitalizations that at least, appear to be proportional to the number of COVID cases. So we're not seeing good information that it's more severe in kids. And that's actually, we have a little bit better data already from the UK looking at that. And they actually saw that there was a slight decreased chance of hospitalization from the Delta variant than the Alpha variant now in kids per case, that is. So even though numbers might go up, the actual overall risk of hospitalization has not appeared to be going up with Delta. But there's also this other variable right now, which is that in some states, also in the southeastern United States, there seems to be a rise in respiratory syncytial virus. So, that's been a little bit of a challenge to tease out, which I don't know how much we want to get into that here, but there's been some issues with codings of hospitalizations of kids with RSV if they test positive for COVID, that in state databases and in national databases, it will also be coded as COVID. But, I know that automatically pegs me as a COVID denier, or like someone who's making things up if I say that.
Conspiracy theorist.
There's 2 studies, and they were discussed in Hospital Pediatrics, which is actually a journal of the AAP that discusses why the hospitalizations among kids have probably been overestimated by about 40%.
Yeah, see, and that's interesting because at the local children's hospital here in Kansas City, they've publicly released some data, and it's fascinating that the RSV curve is exactly the COVID curve. Like it's not
right.
It's exactly the same curve.
Yeah, that's the impression I've been getting, and I would love to see that actually.
So one of the things that I've learned from listening to smart people on the show like you over the last year and a half is that when experts are speaking about public health, it's important to understand risk to the general population and to communicate that openly so that we know who our most vulnerable citizens are and how to protect them. And specifically with infectious diseases, we describe them using data. So like this big picture aggregate data of the population. And with disease that you can catch, the things we care about are mortality, severe disease, which sometimes we think about as, you're so sick, you go to the hospital, and other long-term effects. With COVID, we think about long COVID. Those are all kind of the big things that we care about. So in your mind, as a collector of data, as an epidemiologist, how would the data inform us on these issues in kids, say, compared to adults?
Yeah, so that's a great question, because COVID has been, at least in terms of mortality, has been, very different, a very large age gradient in terms of the mortality risk. So kids, for example, have about a 2,000 to 3,000 times lower mortality risk than over age of 65. So that's important to point out. And I was actually just calculating the estimated death rate in kids, and it's at about 12 deaths per million. So we have just over 300, around 330 kids in the United States that have died, and it was around about 6 deaths per million in the UK, so a little higher than in the UK. But still, it is a low death rate. Of course, every death is obviously very tragic, but I think it's important for people to sort of keep that in mind, that it is extremely rare for kids to die of COVID. And in terms of hospitalizations, that's something that we've also been learning about along the way, and that as severe disease. And it seems like kids now we're looking at about, if a kid gets infected, about a 0.5% risk of hospitalization to as low as 0.3, and about a 1 to 250 to 1 to 350 chance of being chance of being hospitalized if a kid is infected. And that hasn't been increasing with Delta. So that's also been reassuring. And then can I jump in?
Absolutely. I'm going to ask for some clarification that some of my audience will want when they hear that. So in the news, they're hearing about way more kids are going to the hospital now with Delta. And so square that circle for us. Why are we hearing that there's more kids going, but you're saying that the risk from the infection is not any higher?
Yeah, absolutely. So in a lot of states, we're seeing a large increase in cases. Well, in most states. And anytime there's an increase in cases, you're also going to see a corresponding increase in hospitalizations. And so, what I was really interested in looking at is, are we seeing more hospitalizations because Delta is like more severe in kids, or are we seeing more hospitalizations because we just have more cases? And it looks like it's the latter. In terms of the UK data, it looks like it may even be a little less severe, and the same with the data from the United States, but it appears similar in severity. Then I know you asked about long COVID too, and I wanted to get to that because a lot of parents, of course, are worried about that. And I was, of course, worried about that too with my own kids. And so the data that we are seeing, the largest study that was most recently done showed a 1.8% risk of having one or more symptoms 2 months after infection for kids that were positive with COVID. And then the control group that was negative for COVID, it was about 0.9% chance of a symptom 2 months after they were tested. So they also had some symptoms that they were tested for, but so it was about double the rate. But then keep in mind also that those are all kids who had symptoms from COVID, enough symptoms to be tested. So basically we're seeing certainly less than 2%, and maybe closer to even 1% of kids having a lingering symptom or more at 2 months after infection. So that's a lot lower than we had initially heard, because we'd really been following kids with more severe disease in the beginning, or that's at least what it's looking like. So
right. So it sounds like the confusion there for the average layperson comes from forgetting to calculate into their risk the very large number of kids that are asymptomatic with COVID, meaning they get infected, but you might not even know it. And they're definitely not going to show up on CNN tickers with the confirmed cases, so we've got the per infection risk, which is how epidemiologists think about the risk to the whole population.
Right.
Versus the confirmed case risk. Is that, am I?
Yes, no, that's exactly right. And that's, where the infection versus case fatality rate comes in. And it's actually been really hard to get a good handle on what percentage of kids are asymptomatic, but I've seen ranges the CDC is saying 15%. I've seen ranges that it's 90%. I've seen 50% from the UK. So it's kind of, I found it challenging to get a sense of how many kids are asymptomatic from COVID. But
okay, can you see this CDC doc or image now?
yep.
So this is a good illustration of what we were just talking about. If you look here, I'm circling the estimate from the CDC, and this is, keep in mind, this is only up till May of 2021, of 120 million plus infections. But the number we see on CNN is like 35 million, 36 million or so cases of COVID. And so this is just a good representation of how, the CDC does not think it's only 35 million that have gotten the germs inside of their body to the point where they start replicating. Is this are these numbers kind of making sense with the data that you read?
So, yeah, I mean, what they're doing is they're estimating that about 15% of people who have COVID don't have symptoms, and they kind of went across the board with that. But I think it would be, more likely that kids are less, so kids should be more likely to be asymptomatic. But this is a really interesting data set from May, and because they really estimated that in May, 36% of kids had already been infected in the United States, which I think a lot of people don't know. And if the asymptomatic rate is even higher, we could be talking about 50% of kids have already been infected, which is pretty would be interesting to know.
Right. And then this one here you sent me, this kind of shows what you were talking about before with even though there's more cases, we're over here for this is the Delta surge here. We don't seem to be seeing a spike in per case or per infection hospitalization. Is that what this chart is?
Exactly. That's what that's showing. So that's been pretty consistent.
Yeah, I might just put these in my show notes so that people can see them and reference them later. And then one more here on a similar topic, thinking about ways to think about COVID and kids as we go back to school. It's maybe not one of the higher risks that kids might face when they go about their lives. Is that true?
Yeah, that's exactly right. So, we have to think about, what are the actual most risky things our kids are doing. And basically, if we're allowing them to ride in a car, we should feel more at ease with actually letting them go to school, because, it's more likely they're going to die from a motor vehicle accident than from COVID. Now, it's just important for parents to put those risks into perspective. And my kids are out riding their bikes right now, and I'm like thinking I'm more scared of them doing that than getting COVID. I have to be honest, but yeah.
Yeah, and what's interesting about that is most parents of most kids, as the data shows, that is a reasonable way to feel. However, and we feel like we keep having to say this every time we talk about how low those rates are. There are parents, because of the health status of their child, that shouldn't feel that way because their kid, like I've used the example a lot of kids that have been in my life that have had chemo, and they get done with that treatment, they have zero immune system. So, and this is kind of where my beef with all this COVID messaging comes in, is because we talk about these interventions, these non-pharmaceutical interventions like masks and distancing and other things, we talk about them as if they either work or don't work. And then if you want to believe they work, then you believe you're safe and you believe you can do anything. So let's talk briefly about masks too, because masks fit into that category, where there have been some great, awesome mechanistic studies that show, the filtration power of certain type of masks and what comes in, what doesn't come in. That's great. We need to know that, but we should also probably know their limits. Do you see the danger that I see in telling a kid that if they've got the cloth mask on their face, that they're totally protected and can do anything that anyone else does?
Absolutely. I mean, when I was not vaccinated, I mean, I was wearing an N95. I would not have worn a cloth mask if I wanted to, protect myself or to protect my patients. And if we just go over the data that we have from schools where, kids are wearing mostly cloth masks, some surgical masks. We have studies from a large study from the United States, Emily Oster's group, look at it was like 3 million kids, and they didn't find any difference in infection numbers in schools that had mask mandates versus that didn't, versus the ones that didn't. And then we saw the same in school sports. There was a MMWR publication from Georgia. And so we're just not seeing that the mask mandate is really, we can't see that a large level of protection from the masks in the schools. And so, I would say that I was senior author on the MMWR study, Wood County, Wisconsin. And we, the kids were masked in that study, not any specific, they weren't required to wear N95s or anything like that. And they, we did see a low rate of transmission in the schools, but I also do think that, focusing on masks is like the primary method of protection is a false sense of security, because we really don't see that they're even, on a broad level doing anything in the schools. And so like you look at places like Northern Europe, and they've really been successfully focusing on stay at home if you're sick, and paid sick leave, and and free access to testing and
ventilation
and opening windows and holding classes outdoors and things like that. So yeah, there's tons of discussion about lots of feelings about masks, and really not any evidence, at least in kids in schools, that they're helping, that these mandates are helping.
Yeah, absolutely. And that's kind of my issue with it too. I don't know if you're familiar with Ashish Jha from Brown University.
Yeah, absolutely.
The Dean of Public Health tweeted something that I felt very viscerally, which is, after all the billions of dollars the federal government has given schools in the last couple of years to beef up during COVID, if you've got a school that has not redone their entire ventilation system with some of that money, you need a new leadership in your school, because that's probably the single biggest factor you could do to keep kids safe in your school and keep teachers safe, is to have better ventilation. But yet we just keep talking about masks. I'm going to jump in really quickly and just remind you that I am super proud to partner with 2 digital sheet music publishers. RyanMain.com. Ryan Main is a composer, independent, does his own stuff, publishes it himself at RyanMain.com, and is a fantastic clinician and teacher and person. And if you don't know Ryan's music, you need to go find out more about Ryan's music. And so you'll want to go to RyanMain.com and check out his library there. It is ideal for every level of developing singer that you might be working with. He has something that he has probably tailored with your age level in mind. He's an educator first, and a composer that is driven by that educator's motive. And so that's a really perfect combination for those of us who work with developing voices. He's got fantastic stuff and some more advanced stuff as well, but I feel like he hits it out of the park every time with his developing stuff. So head over to RyanMain.com. You're going to get a site license when you purchase over there, which means you'll own that PDF forever and can print as many copies as you want. RyanMain.com, and then enter Choreolosophy at checkout. I'm also in cahoots with Graphite Publishing. Graphite Publishing is another online resource that has a stable of fantastic composers like Eric Barnum, Tim Takash, Jocelyn Hagen are just a few, but they have so many. It's grown a ton during the pandemic. Of course, one thing we know about sheet music publishers is their sales are way down. Everybody's. So they've been doing a lot to build up their library over there at Graphite and to provide you more options for as your choirs come back this year. Even though they are masked, they're going to be coming back. Schools are opening everywhere, and you're going to need some sheet music. And you might have some that you need to tailor to a group you haven't seen in a while. Well, Graphite is ideal for that, because you're going to be able to go into their search engine and look for things like difficulty. You can type in certain difficulty levels, certain accompaniment types, and you're going to be able to just get the perfect piece for you by a fantastic composer there. So head over to graphitepublishing.com and enter Choreolosophy at checkout as well for 10% off. So we have this this document here, and this is from I went and checked some of the citations of this, and it's all pretty legit, and also squares with our big Coral Director aerosol study that our whole world sponsored, where if I'm wearing a cloth mask and you're wearing nothing, in kind of a very average ballpark number, I could infect you within 20 minutes. But if you put on your cloth mask, that gives you another 7 minutes. And so when we talk about masks work, then I think about, I look at stuff like that and I think, okay, so masks work if I'm going into the grocery store and I don't know if somebody's sick around me and I'm going to be around them for a very short amount of time. And I want to make sure they're not going to cough or sneeze on me. And in that case, that cloth mask maybe does its job. But as soon as I'm sitting in a cubicle or in an office or something with that same person for 8 hours,
Right.
that cloth mask is no longer working, quote unquote.
Yeah.
And so, but yet people are being told that they just flat out work and you shouldn't question it. And so that's kind of what I was coming from before with that limitation. Have you seen something like that before?
I mean, yeah, absolutely. Now, I don't know the exact study that this is based off of, but I mean, I think this may be why we're really not seeing a big difference of the cloth mask wearing within the schools, because obviously these kids are in school together for a really long time. And that's, it's an extra 7 minutes of protection is not going to add much. And I think that, that's probably one of the reasons why, Northern Europe and in Scandinavia, they've all either they've never had masks on kids, they've gotten rid of the masks, or they've got a plan for getting rid of them for all the kids across all of Northern Europe. So, I do think that we, if we're going to continue using the cloth masks and say they're helpful, we really should study, with a randomized control trial to see actually if they are, because I don't think we have the answer right now.
Yeah, and I agree with you. I do wish we'd have the controlled trials on those, but in the short term, my issue is really just if you're going to do a mask mandate, if you're going to tell a school they have to wear them, fine, but also educate the people involved of what the limitations are of the mask.
No, absolutely. And that's been, you alluded to it before, but that's been a bit of an injustice if we haven't focused on which kids are really at high risk. Which comorbidities put kids at high risk. We have some idea that it's obesity and complex neurological disorders and kids who are immune compromised, for example, from taking chemotherapy or bone marrow transplant. And, how do we best protect those kids and what can we do for them? I think that's really important. And I think, we also have to say and do we need to have some intervention that has potentially no benefit and pretend like that's protecting all these kids who are actually at higher risk. Like that doesn't seem like good public health. It doesn't seem like good medicine to me. And, the hospitalization rates we talked about, now that wasn't divided up into comorbidity. And I just did some calculations kind of looking at different rates of or risks of hospitalization by presence or absence of a comorbidity. And, it's probably somewhere around 5 times higher risk of hospitalization if you do have a comorbidity than if you don't, making the healthy, the kids without comorbidity all the more safer, while as we need to recognize, okay, there is some risk to some kids, and how can we have focused protection for them? I don't know if that's a banned phrase, but
well, because but it's exactly right, because at this point we've collected more data. Correct me if I'm wrong. We've collected more data on this one disease than any other disease ever in the history of humankind. Right.
Exactly. And it's so if we can't afraid of, I don't know, saying some kids are really low risk and some kids are a little bit higher risk. I don't know why that hasn't been focused on, more.
To me, that's why you collect the data.
Yeah, I know it is really important. Yeah. And I agree with you on that. Okay, so yeah, I also just wanted to circle back to the topic of figuring out how many asymptomatic cases there have been. And I just wanted to say that I actually was trying to look into that question by looking at seroprevalence data and, realizing that antibodies are circulating antibodies. So what, the antibodies that we make to infection that tell us whether or not we've been infected, they decline over time. So So right now it looks like only 27% of kids or somewhere around there in the United States have been infected, when in fact, we know from the data already that the CDC is showing us it's more like 36%. So that's why it's been challenging to figure out how many kids have been infected, because now those antibodies will wane, but that doesn't mean your immunity is gone. It's just those antibodies only circulate in your blood for such a certain amount of time.
So I'm trying a new thing, which is that if the episodes run a little bit on the longer side, I am going to divide them up into 2 chunks, and I will publish them simultaneously. But that way you feel a little bit less overwhelmed when you click on them. So stay tuned. You should be able to jump right in where we left off in this conversation in part 2 of this episode.